Hello guys, welcome back to my YouTube channel Dr. RK Medicos. In this video, we will talk about the sagittal section of head and neck. So continue to watch my video at last and never skip this video. If you are new at my YouTube channel, then please subscribe, like and share my YouTube channel and never forget to press the bell icon so that you will get notification of all video uploaded by me on my YouTube channel. Let's start this video without skipping the time. Firstly, we will see the frontal bone. As you can see here, this is frontal bone and it is a type of flat bone and which is located in neurocranium and it is supplied by the middle meningeal artery. Now we will see the ethmoid bone. As you can see here, this is ethmoid bone and it is a type of irregular bone and which is located in vitrocranium and it is supplied by the anterior and posterior ethmoidal and sphenopalatine artery. Now we will see the nasal bone and this is a nasal bone and it is a type of flat bone and it is located in vitrocranium and it is supplied by the ophthalmic and angular artery. Now we will see the sphenoid bone. As you can see here, this is a sphenoid bone and it is a type of irregular bone and located in neurocranium and supplied by the middle meningeal and internal carotid artery. Now we will see the maxilla. As you can see here, maxilla is a type of irregular bone located in vitrocranium and supplied by the facial and maxillary artery. Now we will see the palatine bone and this is a palatine bone and it is a type of irregular bone and located in vitrocranium and supplied by the greater palatine artery. Now we will see the mandible. Mandible is a type of irregular bone and located in vitrocranium and supplied by the inferior alveolar, sublingual and submental artery. Now we will see the lateral wall of nasal cavity. Lateral wall of nasal cavity. As you can see here, the lateral wall of nasal cavity is formed of the several bone roughly from anterior to posterior and it is formed by the frontal process of maxilla, lacrimal bone, ethmoid, perpendicular plate of ethmoid and the middle pterygoid plate of sphenoid. The three slabs of the bone convex inferiorly extend medially as you can see here and these form the superior, middle and inferior nasal concha and the inferior concha is a final bony compartment of the lateral wall of the nasal cavity. Being a bone in its own right, it articulates with ethmoid bone and the superior and middle concha arise from the ethmoid bone as you can see here. Now we will talk about the mucosa of hard palate. The palatine mucosa coat the hard palate. It attaches to palatine process of maxilla and the horizontal plate of palatine bone. And the mucosa of hard plate is masticatory mucosa and it is lined by the keratinized stratified squamous epithelium. Now we will see the mucosa of tongue. As you can see here that this is a mucosa of tongue and the mucosa of tongue is separated into the mucosa coating the ventral aspect of the tongue and the mucosa coating the dorsal aspect of the tongue. Firstly we will see the ventral mucosa. The ventral mucosa is smooth and is adjoining to the floor of oral cavity via the lingual frenulum and the dorsal mucosa of the tongue is involved in the mastication and the taste. It is divided bilaterally by the longitudinal median sulcus. The anterior two-thirds of the dorsal mucosa faces superiorly and while the posterior one-third lies posteriorly and face oropharynx and continues with the pharyngeal mucosa and the epithelium on the dorsal aspect of the tongue is non-keratinized posteriorly and however the anteriorly it is keratinized and which may be due to the proximity to the external environment. And now there are numerous rise elevation on the dorsal mucosa called the papilla as you already know and this serves as the increase the surface area and contain the taste bud. These are four main type of the papilla, and first is the filiform, fungiform, foliate, and valid papilla, right? And out of this, only the fungiform, foliate, and valid papilla contain the taste bud, and these taste bud are the most prevalent on the posterior region of tongue, and but it is also present in the pharynx. Now we will talk about the hyoid bone. As you can see here, this is a hyoid bone, and it is a type of irregular bone, and which is located in neck, and it is supplied by the suprahyoid branch of lingual artery and infrahyoid branch of superior thyroid artery. Now we will see the mucosa of laryngopharynx. As you can see here, this is a mucosa of laryngopharynx. The laryngopharyngeal mucosa line the laryngopharynx, and it is continuous with the oropharyngeal mucosa above and the esophageal mucosa inferiorly. Anteriorly, the mucosa blend with the laryngeal mucosa. Now we will see the mucosa of esophagus in the cervical part. The esophageal mucosa forms the internal lining of the esophagus. It is composed of the epithelium, lamina propria, and the mucosa muscularis. The epithelium is a non-keratinized stratified squamous, as you already know, and that is continuous with the oropharynx, and it is thick about 300 to 500 micrometer, which aid to protect the protective function. The Langerhans cell of the present in the epithelium and perform the antigen processing and antigen presenting role that important for the immune defense. And the lamina propria is composed of a group of mucosa associated lymphoid tissue that is also known as MALT, and which is also required for the immune defense. The muscularis mucosa contain longitudinally arranged smooth muscle and form the thin sheet supporting the epithelium. Now we will see the mucosa of trachea. The tracheal mucosa is the innermost layer of the tracheal wall, as you already know, that line the tracheal lumen. The mucosa is thrown into the fold along the posterior wall where hyaline cartilage is absent. Surrounding the tracheal mucosa is the submucosa, which consists of the dense connective tissue and mucous gland. Tracheal cartilage and the trachealis muscle surround the outer surface of submucosal layer. Now we will see the epiglottic cartilage. As you can see here, this is a epiglottic cartilage. The epiglottic glottis is a flap of elastic cartilage that project into the oblique fashion posterior to the hyoid bone and the tongue. The superiorly it has a free margin, but inferiorly portion is attached to the stalk of the thyroid cartilage via the thyroepiglottic ligament. Laterally, it is connected to the arytenoid cartilage via the mucosal fold called the aryepiglottic fold. Deep to this fold is the aryepiglottic muscle. The epiglottis has anterior and posterior surface, as you already know. The inferior portion of anterior surface is connected to the hyoid bone via the hyoepiglottic ligament, and it is also connected the pharyngeal surface of the tongue and the lateral pharynx by the median and two lateral glossoepiglottic ligament respectively. Between the median and the lateral glossoepiglottic ligament and a small depression, the posterior surface of epiglottis is smooth and coated with the respiratory mucosa containing the numerous small mucous glands, and it is pierced by the branch of internal laryngeal nerve. Now we will see the thyroid cartilage. As you can see here, this is the thyroid cartilage. Thyroid cartilage is composed of hyaline cartilage, as you already know, and it is a large C-shaped cartilage that is deficient posteriorly. It has two anterior placed lamina, and the inferior two-third of this broad lamina fuse medially, and at the superior most point of the fusion is laryngeal prominence, and which is colloquially termed the Adam's apple. The angle at which the lamina fuse is approximately 90 degree in the male and 120 degree in female. Thus, the angle in the male is associated the more pronounced laryngeal prominence and longer vocal cord and a deeper pitched voice. Now, we will see the cricoid cartilage. Cricoid cartilage is composed of the hyaline cartilage and sits between the thyroid and arytenoid cartilage above the trachea below, and it composed of the anterior cricoid arc and posterior cricoid lamina, and is only the laryngeal cartilage that form the full circular ring. This is all about sagittal section of head and neck. I hope that this video will be knowledgeable for you. Thank you for watching my video at last.